afternoon. Welcome to the Diaries of SARS-CoV-2 Genomics training webinar. My name is Laia Delgado Callico, and I'm the communications coordinator for COG-Train. I'm based at the University of Cambridge. Today, I'll be chairing this event and I'll be moderating the panel. COG-Train is an educational initiative developed jointly by the COVID-19 Genomics UK Consortium and Wellcome Connecting Science. It provides open access learning in SARS-CoV-2 genomics, and it aims to facilitate an increase in global genome sequencing and analysis capacity, reduce sequencing inequality, and enhance pathogen surveillance. This event is part of a series of blogs and webinars with educators, contributors, and reviewers from the COG-Train online courses. This event will be recorded and it will be uploaded to our YouTube channel and to our website. Please feel free to add your questions using the Q&A box at any point during the event, and I'll be keeping an eye on the questions. We also have 2 poll questions for the audience that will pop out during the event so we can get to know you. And without further delay, let's get to know our panelists. Hello, yeah, can you all turn on your cameras? Yeah, perfect. Great, thank you. So can you all please introduce yourselves, talk about your background, whether you were directly involved with the COVID-19 pandemic, and what has been your involvement with the COG-Train courses so far? Let's start with Teresa.
Thank you very much, Laia. My name is Teresa Cutiño-Moguel. I am a virology consultant, a clinical virologist, medical doctor working in virology in London, in one of the largest trusts in England, Barts Health. I have been working during COVID-19 quite closely with the laboratory where I work to provide not only PCR testing for COVID-19, but also for sequencing and identifications of the new variants. I have also been involved in the management of patients with COVID-19 and vaccination strategy, both for our staff and the community. I was actually born in Mexico, but I've been in this country since 2001, and I have trained now really for the most part of my life in London in various universities. And so my involvement with the COG-Train has been, first of all, through COG-UK, because we were one of the centers providing data and sequencing our samples and contributing to the sequencing information in the UK. And then I got involved with COG-Train because I think collaboration worldwide during the pandemic was one of the positives, I suppose, from the pandemic. The world suddenly became a lot more connected. Things became possible that weren't possible before. So I think this is a really good initiative, providing lots of opportunities for both the people that take the courses as well as for the people providing the courses or helping.
Thank you. Hello, Teresa. Welcome. And Gerald?
Thank you very much. My name is Gerald Mboowa. I'm a bioinformatics implementation expert at Africa Centers for Disease Control and Prevention, based in Addis Ababa, Ethiopia. My background, I have a PhD in genomics and bioinformatics from Makerere University. And shortly before COVID, my background was deploying bioinformatics in antimicrobial resistance. And shortly after that, when the pandemic took over, I was employed as a bioinformatics implementation expert at Africa CDC in Addis Ababa. So part of my role under this position has been training bioinformatics. Over to you.
And your involvement with COG-Train, you were in the first course, a contributor, right?
Yeah, so I was a contributor in the first phase.
Okay, and now to Paúl.
Hello, everyone. Thanks for the invitation. My name is Paúl Cárdenas Aldaz. I'm from Ecuador. My background is I am a medical doctor, and then I did my master's and PhD at the Imperial College of London in molecular genomics. Since I'm back to Ecuador, I was trying to establish a microbial genomics lab here in my university, Universidad San Francisco de Quito. And we were working already doing sequencing of pathogens, especially neglected tropical diseases like dengue, Zika, chikungunya. So since the pandemic started, we started doing the SARS-CoV-2 whole genome sequencing and do the genomic surveillance here in Ecuador. I I have continued until now we are already 116 weeks sequencing unstopped samples from the whole country. Of course, also to advise the government in terms of which variants are currently in the country. I have been involved in the COG-Train course, in the second course, as a contributor.
Yeah, perfect. And Rogers?
Yes, thank you very much. Hello, everyone. Thank you for joining. Rogers Kamulegeya is my name, from Uganda, Africa, Makerere University. My background, I'm a biologist and I have a master's in immunology and clinical microbiology. Back home at the University Makerere, I coordinate a biobank, the first in Uganda, and has been the cause for spin-off of very many biobanks now in the East African region. And during COVID, actually, the biobank with its support labs was one of the leading testing centers in the country. And I think up to now we have tested over, I don't know how many millions of samples, and we have also been biobanking those samples. And as such, those samples were helpful in a validation of test kits in the country during the pandemic, which test kits were then adopted for use as point of care and also in different regions. And also with the biobank samples, many pharma and companies and biotech companies have been able to use these same samples to advance diagnostics, manufacturing, and therapeutics. So in the training, I was an educator and from swab to server course. So thank you for inviting.
And our last panelist, Varun.
Yeah, thank you, Laia. I'm Varun, I'm from India. So I'm from Central Research Laboratory, KIMS. So we are a national reference laboratory for pneumococcal vaccine evaluation, basically. We started our RT-PCR lab for testing of COVID in July 2020. And then we continued with it. And then in 2021, we became an central site for genomic sequencing of SARS-CoV-2 for Indian COVID Genomics Consortium. So I am involved in sequencing on nanopore of SARS-CoV-2 genomes as well as bioinformatic analysis. And then we report the variants of concern and things like that to the government of India. So this is about my background on SARS-CoV-2. So in COG-Train, I was a reviewer for the first course. And then I'm an educator for the third course, which is coming up next month. Yeah. Thank you.
Yeah, so let me recap. Teresa was an educator on our first course. Gerald was a contributor for the same course. Then Varun was a reviewer and also an educator for our third course. And Rogers, an educator for the second course, and Paúl, a contributor for the second course. And the first course was the power of genomics to understand the COVID-19 pandemic, and it ran during the month of February on FutureLearn, but is open again for registration. Our second course, from swab to server, testing, sequencing, and sharing during a pandemic, is currently available on FutureLearn. And our third course, making sense of genomic data, COVID-19 web-based bioinformatics, is open for registrations, and the course will start at the end of July. And let me also define the role. So an educators are a team of global experts who design the curriculum and decide about the content and how it will be delivered. And they also interact with the learners when the course is live. The contributors are experts based in different parts of the world, and they contribute with a small piece of content like an article, a video, or an interview. And a reviewer provides feedback on the course, identifies gaps in the content, and ensures that all the content is scientifically accurate. So now that we've met our panelists, let's also get to know our audience. If we can launch the poll, please. The first question should appear now in your screens. So we're asking if you've been a student in any of our courses, whether you've been for the first course, the second, both, or not yet, and you are looking forward to it, or whether you are one of our educators, contributors, or the COG-Train team. So at the moment, we don't have any student. So I have like 9 answers that saying that not yet, they haven't participated in our courses yet. 12 answers, 12 people saying, 14 now saying they haven't participated in our courses. And then 8 people from that were either educators, contributors, or organizers. Okay, now let's move to the next question, please. So it seems that we have no students. And now I'm asking about your background, your profession, whether you work in the healthcare sector, you're a scientist, or both. You can also answer select multiple answers, or you work in the education sector, or you're a student, either an undergraduate or PhD student, or any other option. So we have 14 students, a lot of young people, I assume. And then we also have a mix of scientists, mostly scientists and students, but also some educators and healthcare sector, so a mixed audience. Okay, that's been great, thank you. So let's get back to the conversation. What were your motivations for collaborating with COG-Train and our courses? So how did it all start? Paúl?
The main motivation for me was to share our experience that we have gathered during these 2 years. Of course, no one was ready for a pandemic. As a microbiologist, we always said we don't know if it's the best or the worst time for a microbiologist to be. But all the experience that we gathered during these 2 years, I think it was important to share with everyone. And of course, with different backgrounds in terms of different countries and availabilities in terms of technology, I think it's very different to do this type of genomic surveillance comparing developed countries with developing countries, not only because of technology gaps, but also in terms of getting regions or getting computers to do the analysis and everything. So I think it's important to share our experience so more people and more countries can do this.
Yeah, very interesting indeed. And Teresa?
I think for me, one of the main motivations was I really wanted to be part of an initiative that is trying to link people to allow people to share, like Paúl said. So it was really just wanting to be part of it. I think, as Paúl said, indeed, the experience everywhere has been quite different, but at the same time, it was the same because it's almost the first time at least in our memory, that we are really all living the same thing at the same time and in so real time. So the connectivity that, all these things we have now, like Zoom, has just made possible to be sharing things at the same time with people that are exactly at the other side of the world. So I just thought it was like a really positive thing to come out of something that has been really hard. And yeah, exactly like Paúl said, you don't really know if it's the best thing that has happened to you or the worst thing, because it's been incredibly exciting and interesting from the sort of scientific point of view, but obviously it's been a devastating time in our lives in many aspects, and more so for some people. So it was really, I think it's probably the same as Paul, just sharing and hearing what other people have experienced, and if there's anything that you can learn from others or maybe teach others, I think it's always going to be a valuable experience.
Yeah, exactly. Varun?
Yeah, actually, my main motivation was to create awareness of COVID genomics and things like that. When I came to touch with the COG-Train people for the first time, we were asked to give some feedback about how they have to develop the course and things like that. In our case, like an LMIC like India or like other neighboring countries as such, Pakistan or Bangladesh, this was also very limited. I mean, we didn't had too much of training about how to go about sequencing of SARS-CoV-2, nor the analysis pipelines. It was very scarce, and we had to struggle a lot at the beginning of the pandemic to know how these things are to get it done and things like that. So I thought it's better when I got the opportunity for COG-Train. So I used that so that what I learned from the basic thing, so that I can teach to others and they can also learn from us. That's what the main motivation for me. Yeah.
And Rogers, what about you?
Well, thank you. I think just like the rest, to share the experience that we had in our country. Like I mentioned, I participated in from swab to server course. And in that, the aspect of biobanking to me was quite an important aspect that I thought would be important to share. Since we are talking about having data, because a sample is rich, it has all that. And at the end of it all, it's ending up on a server. So it will be used by many other people to enrich themselves and also to make healthcare better. So there are many ethical hurdles that are in between there. And I thought having some information that I know brought on board would be quite important. And also I had students that I thought would be challenged actually to participate in this collaboration. So I had some of my students that had to be brought on board and they participated. And I think they now see what the rest of the global world is all about and they've been challenged. And the last motivation was participating in such a training. Myself, I was learning. So I love learning. So it was also motivation on my side to be part of the collaborators. Thank you very much.
And Gerald?
Thank you very much. So when the course started, I think I just started this position of the bioinformatics implementation expert at Africa CDC. And one of my roles was to train bioinformatics across the continent, which has 55 member states. That was a huge, huge undertaking. So looking back and the fact that so far 52 out of 55 member states have managed to contribute more than 100,000 SARS-CoV genomes from Africa. And just between January and June, where we are, we have sequenced and shared on GSAID more than 50,000 SARS-CoV genomes. So for me, this course came in to do what I was supposed to do at a scale that I hadn't seen before. And when I came across it, I started sharing it with so many of the trainees, different researchers across Africa, and many of them enrolled for the course. And I found my work so easy moving forward. So that is it.
So you've talked about your motivations, but maybe there were also some challenges when you agreed to participate, and you've mentioned lack of resources, for example. What were your main challenges when developing the educational material? Varun, for example?
Yeah, I mean, there are too many courses which are out there on the internet to learn about things, but they are not interconnected to each other to start with. For example, there were seminars on Arctic protocol, how to do it. And then at the end product, they only thought how to get the sequencing out of it, but then not the analysis part. So connecting things was very difficult for us at the starting. So we thought we should make a course which such that it starts from sequencing and ends with the analysis part with getting the variant. So it's kind of easy, but it was difficult because we were a panel of 4 members. We were discussing about the educational material, and we had to sit each other, every week we had meetings, and then we had to connect each other's, and then we had to finalize things based upon different of opinions and things like that. And then we had to check out, because some people use different method of analysis and we use different method of analysis. So, but basically at the end, we all sat together and discussed, and then we came out with the new course. Yeah. So yeah, that's it for me. Yeah. Thank you.
Yeah. Working on a team and getting an agreement was a challenge, but good outcome, so good. And Rogers?
Oh yes, knowing something and sharing what you know is a different thing altogether. So I think the biggest challenge I had is how best can I bring out what I know and share it with thousands of people so that they get to understand the concept. So illustrations, having something that will be shared internationally and all of us are on the same page, I think was the greatest challenge. Yeah.
Yeah,
But
and
yes.
the pressure that what the material that you're creating will be there probably forever.
Surely, yes.
And Teresa, what about you?
I think it's trying to pitch to such a big range of people, because some people will know a lot, some people know very little. As you know, as I've said already before, some people have, as you know, everybody has a different background. So knowing how to present something so that is understandable for people that have very little background, perhaps in genomics or in virology, is without making it boring for people that will have maybe some more, is quite difficult, because it's quite it's quite harsh when you deliver something that people find boring. So you really want to be engaging, and that can be quite quite difficult. And I hadn't really thought about what you just said. You just made me feel like completely terrified. But the fact that it's going to be there, I didn't really think of that. I'm glad. But yeah, you really want to get it right with, for example, the narration of one of the little videos. I was very aware, for example, of my own accent, and thinking like, is this going to make it difficult for other people to understand, or I don't know. So you start, like I just said, it's very different to know something than to know how to deliver it, to explain it to other people is completely different. Even if you know the stuff, to explain it in a way that is engaging and it's clear is quite difficult. And yeah, I think to a certain degree, when you do things like narrating a video, for me in particular, I start being very aware of how I'm pronouncing things, because it's my second language. And so yeah, those were challenges for me.
Yeah, I think we can all relate to having an accent. But based on the good reviews that the first course had, like, you did a great job. And we'll get back later to the good reviews that we had. And now, Gerald, what were your challenges?
So the challenges basically was more like I've already said, when it comes to Africa, the continent is diverse. You have almost 5 different languages being spoken across 55 countries. So you forward this to French-speaking countries, it comes back. So the challenges was more of like, okay, fine, when you forward this link to the English-speaking countries, the only feedback you get is, okay, there's this part. And many of them, of course, you would refer them to the commentaries that are done on different questions, but still the challenge remains in Africa. Different languages are being spoken, and you have to realize that so far, even if you have this course going to be on this platform forever, it may not reach out to maybe Portuguese-speaking countries, and that still remains. That's a challenge I feel. And even me technically as an expert, I can't go and teach bioinformatics in French or in Portuguese. So that is a challenge that I think up to now I still see is one of a challenge we will need to overcome.
Yeah, I agree. And we are working on that. And Paúl?
Well, for me, it was to gather all the information that I think it should be important to share, and also to compile it to make it engaging. So I think it was difficult. I made an article, so I had the time to revise again and again what I put there. But still, I wanted to share a lot of things. So for me to gather the information and to compile everything what I wanted to say was the most challenging part of the exercise of writing this article.
And I'm also aware that we gave you a short deadline, so that might have been a challenge as well.
Yeah.
So we've talked about challenges. Now let's focus on positive things. Has engaging with our courses helped you in your professional career? Teresa, for example?
Yes, I mean, apart from anything else, it's made me, you know, like we were talking about before, you know things and you don't know how to explain them. So you learn when you break them down and say, can I actually express this in a way that makes sense? But it's also made me study myself and kind of like fill the gaps of things that I've been in, particularly with genomics and sequencing, being a doctor, a medical doctor, probably a lot of the things that I was dealing with every day. I hadn't actually taken the time to sit down and read more to understand the basics, the science, because we use it as a tool in the end. So they were very involved. We're not the ones actually running the test or running the bioinformatics. So it has been really useful.
Yeah, I'm glad to hear that our educators and contributors are also learning with their own courses.
Yeah, absolutely, absolutely.
And Paul?
Yeah, that's clear. Well, I'm from academia, so part of our job is to also teach what we do to students. It has been good for me, for my career, in terms of trying to reach a wider audience. In this course, of course, it was because of the great job that COG-Genomics UK has done. A lot of people got interested because it was an example to follow. But also that people get to know us, that we are doing this thing in other countries, in Latin America, in countries, small countries like Ecuador. It has been very important.
Yeah, I agree. And you have an excellent network that has been sharing this event on Twitter. I've seen that. So thank you to your supporters. And Gerald?
Yeah, so what has been one of the most beautiful part of this course has been, normally initially we used to say, okay, we are going to train in Eastern Africa. You have to organize about 15 countries, participants from 15 countries, about 20 of them. So now what we do is you send this course ahead of time. And maybe before that, our courses, the face-to-face courses used to last for 10 days. So you send this course ahead of time. You tell them, please take this course, and I want to see the progress of everyone. Probably share the certificate at the end of the day. So it works as a baseline. So that by the time I come in, I know it has ironed out some of the items where I would have spent maybe another 2 or 3 more days trying to make things a little bit clear. So it is setting a ground, a foundation for me before I go in to do the remaining parts of the actual, maybe hands-on bioinformatics training. So until we continue to do the same.
Yeah, so you're making the best of both worlds, taking the online courses into your face-to-face courses.
Yeah.
And what about Rogers?
Well, as an academician, still, I think this was one of the best opportunities for my students. It came in just at the time when the semester is beginning, and it makes it quite simple to share the link with the students and tell them, look out for this information. From the first training, actually, to now training 3 and the rest of the trainings, they're anxious looking out for those trainings so that they learn, they get actually, how should I call it, complementary information from the information that I do teach to them. So to me, I feel it has helped me that way to have the students get on board. Thank God, Gerald, my colleague there, was one of the trainers. So seeing Gerald as one of the trainers, well, made them a bit happy. Then secondly, I would say as also a trainer in my profession, during the time of material preparation, it was also an opportunity for me to learn. Like we said, knowing something and then presenting that same thing are 2 different things. But as we engaged with different educators in preparing the material, it gave me quite more insight and understanding and made the work easier. So I believe going forward in my profession, it will be something better. Yeah, thank you.
Yeah, that's why we have teams of educators, so you can all learn from each other as well. And Varun?
Yeah, actually, like Teresa told, like it was learning for me from the course which I developed. Basically, in last year when the Delta outbreak happened, and then we had to do the sequencing in like a factory thing. We had to do more amount of sequencing and submit the reports to government. But we didn't have too much of time to look through what is happening, why it is happening, and things like that. But then in this year, we didn't had so much of load on us. So when I developed the course, it was more of learning for me, like why did it happen? What was the SNPs and things like that, and how did Delta was more like, infectious than Omicron and things like that. So it was more of learning for me. And then like I am not a academician, so I don't teach to others, but then definitely these courses made me like how to organize things to teach it the students. So that's my learning for me. Yeah.
Yeah, it takes a skill to teach and be able to teach well. So Gerald, for example, you said that you brought the online course to your face-to-face teaching. How does it compare, like having an online teaching experience versus a face-to-face teaching experience? Like Gerald, for example?
Okay, so this, what I can say is you send this to the prospective participants ahead of time. So they have time to go through this course. So by the time you are coming in, you're just coming in to respond to what they feel were the challenges. So if it took someone 2 weeks to get this course done under their normal schedule, during the face-to-face, you can just go through these bits of it within less than maybe a day, and they're able to understand where they have challenges. And normally this gives you a way forward in that next time you're delivering this course to a different group, you know where to put out of emphasis in the different parts of the same course. If you have to deliver part of the same course elsewhere, you know where you're likely to spend more time when you're trying to deliver a face-to-face course.
And Rogers, what do you think?
Not to be any different from Gerald, I think trainings involving multi-sites are actually quite challenging, especially now during this time. You don't know which country is having bans on travel, getting visas and all that. But having an online training actually eased reaching out to thousands of people just in 3 weeks. And yes, instead of having to travel to this site and the other site. And then also sharing this information, just like you had said, ahead of time, students have a better exposure. So by the time you come, you're just addressing a few challenges they found in the course. Yeah, so that's what I could talk about the whole experience.
And Paúl?
Well, I think it was a great experience to gather different people from different parts of the world with different experience to make a course that suits to everyone. So I think that is very important. Also, the experience for my students, undergrad and postgraduate students that got enrolled in these courses. They say it was great to also not only to learn, but also to get to know other students in the same situation in other parts of the world. So I think that was also a very important thing that these courses have done, not only for us as contributors, educators, but also for the students.
Yeah, and well, I'm glad to hear that all your students also took part in the course. And Teresa?
I think for me, the best part of the course was actually the interaction with the students. It was, it was really the point at which you were really sharing your experiences and hearing what people had to say. Obviously, it was nice to hear positive comments, but it was also interesting to see when people thought that something wasn't clear or could have been said better, or could have been explained in a different way. So I think that's probably the best part of the course.
Yeah, so despite our courses being online, we also have the educators being involved in the discussions during the first month. So that's where they interact.
Yes, exactly. Sorry, I should have said that. But there was exactly not at the point of delivering the course or doing the recordings or the documents, but at the point of having that moderator week where we would have the direct interaction. That was really nice. It made it feel more real, and you could see as well where people were from, what they did. Some people were quite engaged, so they sent several messages. So that was really nice.
Yeah, and people were happy because our courses the first one received a score of 4.7 out of 5 in reviews on FutureLearn, and the second one 4.6 out of 5. And we have also received excellent feedback from the participants on Twitter and LinkedIn. And let me share some of them. So the course was easy to understand for myself who does not work in a lab. The whole course has had excellent learning opportunities for my job role, and I can share this knowledge with my colleagues and public. Thank you to the team. My thanks to our trainers, to all the organizers, and all my congratulations for such a good initiatives. So what has been the highlight of the course for you? Teresa, do you want to add anything? Well, you've already mentioned this interaction.
I think, yeah, it really is that, because that's when it really becomes like when you really feel part of something, because there's so many people that are sharing comments and directing some of the questions directly to you. So it's a platform that you don't normally have. And yeah, there were people from literally all over the world, I think. So that was really lovely, and that was a point at which you can actually learn from questions they ask, perhaps that you haven't thought about, or that was a highlight, I think, for me.
Yeah, exactly. And Paúl, what about you as a contributor?
Well, for me, it was I was very happy to share my experience in what I have learned during these years of the pandemic, and also to be part of this group of contributors and also educators around this COG-Train. So I think it was very important to form or to gather people from different backgrounds, different countries, to share their own experiences. So I think that made an extra plus on the course.
Yeah, that's what we are hoping, that the networks that we're creating last beyond our courses. And Gerald, what about you?
So personally, understanding how it can complement the bioinformatics training, especially for SARS-CoV in our own setting, is very important. And for me, I learned that, because even when we had the 10 days for the face-to-face trainings, we would still get people saying, you know, we needed more time. And for me, that wasn't going to work, because even 10 days was very costly. So now I appreciate that you can put in so many man hours, develop this content, and it will have impact compared to face-to-face, where you are going to pay for flights, accommodation, trainers, and very expensive face-to-face. So I understand that this can be used in a way that it complements the face-to-face training, and you end up saving on so many logistical and cost implications for any training. So for me, that's a take home.
Yeah, and let me also highlight that, Gerald, you were featured in one of our Meet the Researchers posts on Twitter, and that was very popular post. And what about Rogers? You've mentioned that you've involved your students. Moses was an educator. Any other highlight for you? Or?
The biggest or greatest highlight that I would say is the peer teaching. Peer teaching, having reviewers, and I would call it the baking process of this content. The content goes through superb baking, and by the time it reaches out, it's good quality content that is easily shared. So it counts as a one-man lesson preparation that you're going to prepare and then teach to your lesson. Yet this side, you have many people, you discuss, have reviewers, have the best content that comes out. So to me, I would say that is the best highlight I have for the course.
Yeah, every course goes through various rounds of iterations until it reaches its final form. And Varun, you have not been in a live course yet, but you've been a reviewer. Do you have any anecdote to share with us?
Yeah, from my experience as a reviewer, like the first course was very well organized. There were some minor things that had to be reorganized and things like that. But other than that, it was like in a stipulated, less now time, they had prepared all the materials basically. So everything was well organized. So like a peer review of paper, we did the review of whole thing. As Rogers told, it's like making it better than what we had. So there were 3 reviewers, I guess. So we gave our comments for the for the good of the course, and basically, and then also I took the course after it came out. So we saw that our reviews, what we had given, were changed, and some of the parts were reorganized to make it look better. So overall, the course was very much well organized because it goes through 3 rounds of reviewing. Once educator is done, it will go to the COG-Train members and then comes to us as an external reviewers. So even though the the course content are like, when you write an article, it is just 500 words. So they have to put in so much of efforts to say what they want to in just 500 words. So sometimes it happens that what they had to say will miss out and things like that. But as reviewers and things like that, we could make it better. So in the first course that happened, and the course went out well. Yeah.
Let me address the audience because I see that participants are raising their hands. If you have a question, please post it in the Q&A box and I will ask them later. And now back to the conversation. So we've already mentioned that the educators are live during the course and they get involved in the discussions. And on our first course, The Power of Genomics, it ran during the month of February, and there were 2,300 participants from 130 countries. On the second course, there were 1,400 participants from also around the world, and there were a lot of comments, like more than 3,000 comments. Then you mentioned, Teresa, that was a highlight, but how did you manage such level of participation?
Well, it was hard to kind of keep up, really, but it gets a bit addictive, because you start checking, and in theory, I think we were given a certain amount of time we had to spend looking at comments a week or a day, I can't remember, but it was like a set time that it shouldn't take more than this, or you shouldn't spend more than this time. I don't think that happens, because once you see something good or bad, or, you know, any comment really, because some people actually reply on that, and it gets a little bit addictive. So you do spend perhaps a little bit more than is recommended certain days when you can actually. But yeah, just you know, to be honest, it's quite intensive because it's just a certain period of time. It's not like a regular thing, and because it's interesting, because in the end, is in some ways it's not always directly feedback on something you've done, because some of the course we didn't. I mean, I didn't do all of it, so it maybe wasn't necessarily specific to something I had either written or, you know, narrated or drawn or whatever. But in the end, it's part of something you have worked with other colleagues. So it is interesting. And I think that's what keeps you kind of like checking and going and answering. So I don't think that, well, I mean, at least I didn't have a technique in particular. I just found that because it's interesting, because you want to know, you just basically log in and you get very involved.
Yeah. And what about you, Rogers? Did you have the same experience?
Quite the same experience. It was my first time. It was a new thing. So I had this anxiety and interest to just follow up and see actually what the trainees are responding to. And so to me, I would say it was fun following up all through and reading everyone's comment over time. Of course, you had to dedicate time to be able to go through the comments, since we are in different time zones and different people would comment at different times. But well, the fact that it was an interesting activity altogether, I think it gave me the urge to keep checking out every day and responding and liking and commenting, and yeah. So that's how we're able to manage.
Yeah, well, thank you for being so involved in our courses. And well, Varun, you know what's coming with our third course. You're an educator. Can you tell us a bit of, can you give us a brief summary of what learners can expect from this course?
Yeah, so this course is all about doing the COVID genomics without any Linux system or a server in your workplace. So using the web-based bioinformatics, basically the Galaxy servers and things like that, the students are going to learn how to assemble the SARS-CoV genome and also use different web tools like Pangolin as well as NextTrain to assign the clades as well as lineages. So this is basically targeting the, like, you know, the countries where there is less resources and things like that, so that they can utilize only the web-based things. So they can upload only like a limited set of samples to the server and get it analyzed. So here we have talked about basic things, starting with how the sequencing is done and how the sequence is obtained. And after that, we'll move on to the bioinformatics part majorly throughout the second and third week, where we focus on running different pipelines on Galaxy, and then interpreting the results out of COG-Train and Pangolin, as well as doing some phylogenetic tree and then visualizing them on the microreact. So this is what we have got for the third course. Yeah.
Perfect. And just to remind the audience that it's already open on FutureLab, but it will start at the end of July. So we're reaching the end. And before we go to the Q&A, I have one last question for you. Do you have any advice for those looking to either start their own training initiatives, or whether if you were to do this again, what would you change, or something that you really liked? Paúl, for example?
Yes, I will say that it is important to share the experience, but also to try to learn from others. So to be open-minded, to gather other people, not only to teach your way to doing things, but also to enrich your course with different types of experiences, point of views, backgrounds as well. I'm a medical doctor, but also I work in microbial genomics. But for me, it is important when I tell what is the medical importance on doing something. So, but other colleagues that have different backgrounds want to share other things. So I think it's important to be open-minded, form a multidisciplinary team. So I think that is very important.
And what about Gerald?
Right. So what I've learned is, in case you are to deploy the same kind of training, then looking at the impact you want to pull, then you need to kind of balance. Like we had for this course, looking at the first course of genomics, you had more than 2,000 participants from over 130 countries. So to me, that comes into the innovativeness of the people on the other side, that they pull people from different continents or different geographies. And now that power alone in the composition of the trainers or the contributors also brings that with it when it comes to looking at the participation and the coverage of the content itself. So, looking at developing the courses on the same platforms, looking at where your target is. If you're targeting maybe Europe, try to zero down into that. If you're looking at beyond where you are, then you try to also represent that into the contributors and the collaborators you are putting on the platform and in generating the content for these courses. So that's what I get. Thank you.
And Rogers, what about you?
For the training to have impact, it requires that grilling and baking and reviewing and refining so that you can have the best content for absorption. So my advice, therefore, is for you to have such a training, a high impact training. I would regard this as a high impact training. You need to have to put aside time and also have variety of, I would say, contributors. For my case, for example, things that I could not do on my side, I had to engage different people who had the skill and talent to refine, do illustrations, do animations, do all this so that they can bring, actually having different people's ideas shows you different people's aspects and perspectives, which helps you to prepare something that would be good for absorption for example, the entire globe. So that's what I say, that you require enough of a variety so that you think about what you're preparing and then have it reviewed and refined so that it can go out. About what to change, I really don't think there's anything that we just need, I think, to add more of time for preparation and look out for maybe people from the different continents, most of the South, yeah, so that we can have them encouraged to join the courses. Yeah, thank you.
We're taking note of your advices. Do you want to add anything, Teresa?
I agree with Rogers. I think the more people you have involved, the better. I would say my advice would be do it. If you have an idea, do it. My experience is that people everywhere in almost any setting are willing to help when it's about teaching others. I think it's a very particular thing where it doesn't matter what background, what setting, in a hospital, in a school, online, people want to be part of it because it's a very fulfilling thing to do. So that means that you have to reach out so that, you know, it's diverse, it's interesting, and obviously none of us know everything about anything. So the more people you have in your course, the more interesting and probably the more complete it's going to be. But most important, I think, is if you have an idea to follow it through and to just do it. And you will probably learn and possibly change things on the way, but nothing has to be perfect to be given a chance. I wouldn't change anything about this course. I agree. I think it was I think in general, COG-Train is a great initiative, and it probably will get better just by the nature of, you know, of it being around for more time and more people being part of it. But as it stands, I think it's a very good idea, and it has been really good.
Thank you. On behalf of COG-Train, we are honored. Varun, do you want to add anything?
Yeah, like I go with the words of Gerald, like you have to target what audience you want to focus on basically, and then start building up your materials. And also I agree with Roger saying that you have to have your materials reviewed and then baked, as he told, to make it better and better. So, but the thing is, for in our courses, what has happened, we have taken all the courses separately. I mean, it's not all the courses are not interconnected. So we have taken consideration that you have to start from basics and then go to the advanced level. So what has happened is, in our course, in the first week, you learn more of basics about what SARS-CoV-2 is and what's its nature and things like that. But then when it goes to second week and third week, it is more of bioinformatics. You learn the analysis more there. So we have structured it like that so that everyone can get benefited. For some people, it may seem like they are teaching so much basics that we know already. But for some people, it may be helpful because they know, big things, but they don't know the smaller things that they have neglected as such because it's smaller things. So that's how we have targeted this course. So I think it depends on whom you're targeting and also how you're going to structure it out. Yeah.
Yeah, thank you. So now let's go to the Q&A. So we had someone ask, they wanted to know more information about the bioinformatics course, but I'm sure Varun has already addressed this with his explanation of the third course. We also have one question about, have any of the panel used any of the skills they used on this course to inform their local teaching? And I see, Teresa, you have already started answering this on the chat. Do you want to go on?
Yeah, sorry, I forgot that we had to wait. Yes, absolutely. And the other way around as well. I think I have been involved in teaching to different grades of, medical students and scientists and children, and during the pandemic in particular, young people. So I have learned quite a lot from those. That's one of the good things about face-to-face. You can see the faces of people and you can see if they're totally bored and, the teenagers looking on their phones and, so you start learning about how to kind of read, are people actually completely bored? This is too high, too low. So I've used that experience. It doesn't apply obviously because it's not a face-to-face, but I have learned certain things that are useful when you're trying to explain a concept. So rather than a lot of words, maybe an image will show and will explain much better. And the other way around as well, of course, I mean, it's there were skills that I had to develop for this course that I hadn't actually had to use in previous experiences. So I think it's been, in both ways, I've used the experience.
And what about Rogers? Any skills that you've transferred? Rogers?
Yes, please. So I would still talk about peer education, peer training, because it's my key highlight in this. Yes.
And Gerald, do you want to add anything?
Maybe like from my side, what I was request that maybe you share the experience, especially with the first course that was oversubscribed. I don't know if you can run a commentary trying to, I've seen this with other training programs like the Bionet down here in UCT South Africa. After organizing such a successful kind of course, they try to share their experience, put it out there so that people who in future think they want to simulate what you have done can always learn lessons and see where they can do better. So that's my recommendation out of this.
And I also know that, Paúl, you've participated in local courses after participating for the first time in our courses. Did you transfer any of the skills?
Yeah, sure. As my colleagues have said, it's different to do a face-to-face course than an online course. And here we had to do both, especially because of the travel restrictions. We got asked to do an online course, so we developed step-by-step videos on YouTube and in Spanish, because it was the audience was people from Latin America, so they were able to see what we were doing, but also we had a seminar when they were able to ask questions. But of course, it was not as elaborated as the COG-Train courses, but we were able to learn from these courses what we can implement in the local courses. And also we had the opportunity to teach people from the local government in terms that they implement not only academia do the genomic surveillance, but also the national institutions. So I think that was very important.
Yeah, and well, I won't ask you, Varun, because I know you don't teach as your daily job, but do you want to add anything?
No, actually, like we work on AMR basically. So I'm going to develop some courses on AMR for my clinicians, basically based on out here in India. So definitely I'll use some of these things which how I used to develop the course materials. Definitely it will be used in the coming days. Yeah.
Thank you. So we have more questions that we have time for. I will just answer one because it's asking about public health authorities, and I will just say that we have a 5th course that will be based around public health policies. So maybe you're interested in that future course. And we've reached the end of the event. Thank you all for coming. Thank you to all the panelists, the audience. I hope you enjoyed this event. Thank you also to the COG-Train team, and especially to Kim Smith for helping organize this event. I hope you enjoy it. Thank you, and I wish you a warm goodbye. Bye-bye.